Good afternoon, everyone, and welcome to today's webinar, FY 2021 Collaborative Crisis Response Training Program, hosted by the Bureau of Justice Assistance. At this time, I'd like to introduce today's presenter, Maria Fryer, Policy Advisor with the Bureau of Justice Assistance. Maria?
Thank you very much for that introduction. Hello, everyone, and thank you for participating in today's webinar. My name is Maria Fryer, and I'm a Justice System and Mental Health Policy Advisor for the Bureau of Justice Assistance at the U.S. Department of Justice. I oversee the justice and mental health portfolio and numerous federal cooperative agreements, training and technical assistance programs to assist states, local governments, tribes, and behavioral health organizations to better understand the relationship between criminal justice system and people with mental health conditions and disabilities who encounter the justice system. At BJA, I help to create policy and programming that meets the needs of state and tribes and local governments, as well as the citizens they serve. It is my hope and vision that training and technical assistance is available to all law enforcement agencies and their community behavioral health and disability partners to improve enhanced responses, to increase safety, as well as connections to services, and to reduce the number of crisis response encounters. Next slide, please. So today, we'd like to give you an overview of the webinar first, and there will be an overview of the Crisis Response Training Program, and after that, we'll discuss the eligibility, the program goals and objectives and deliverables, priorities, federal award information, budget, review criteria, performance measures, followed by the submission requirements, and finally, towards the end of the webinar, we'll have time for questions and answers. Next slide. So here at the U.S. Department of Justice Bureau of Justice Assistance, our mission is to help make communities safer by strengthening the nation's criminal justice system. Its grants, training, and technical assistance and policy development services provide state, local, and indigenous nations with the cutting-edge tools and best practices they need to reduce violent and drug-related crime, as well as support law enforcement and combat victimization. Next slide. For an overview of this program, the Crisis Response Training Program provides support to law enforcement and corrections on how to effectively partner with mental health and community service agencies to promote public safety and ensure appropriate responses to individuals who have behavioral health conditions, intellectual disabilities, developmental disabilities, and physical disabilities. Specifically, this program seeks applications that will plan, develop, and deploy a best practice training program for officers that include their community. They will develop a strategy for deploying officers trained in crisis response during times of crisis and evaluate, improve, and sustain community engagement and a best practice program. Next slide. In terms of eligibility, if you're familiar with the JMHCP program or the Justice and Mental Health Collaboration Program, this program is very similar, except there are two major differences. One, correctional entities are specifically mentioned and invited to apply, and two, the target population to be served includes people with disabilities. I'd like to make one note here in terms of eligibility. BJA uses the term behavioral health to include mental health, substance use disorders, and co-occurring mental health and substance use disorders. It does not include intellectual, developmental, or physical disabilities, which are specifically mentioned, which BJA considers to be a separate category. Next slide, please. So the program goal, to support crisis response training for state, local, and tribal law enforcement and correctional entities that will ensure organizational planning, strategically deploy those who have been trained, and ensure sustained best practices. Next, we'll talk about the program objectives. One, applicants will use this analysis or any type of analysis that will help you to determine what type of program that your agency would like to develop or improve or enhance. Some communities use system mapping and other types of ways to determine what type of training, partnership, or resources that your community might need. You can also anticipate future deployment models which will determine training needs of the applicant entity. BJA encourages using BJA's Crisis Response and Intervention Training Program curriculum, which includes best practices from the Memphis Model Crisis Intervention Training Team model. Also, there's such training teams as disability response, co-responder response models, behavioral health mobile response, case management, and other response models. Next slide, please. We'll continue with these objectives. Applicants will also seek and deploy other best practice training for officers, or define and track process measures as well as short-term and long-term program outcome measures. Also, employ data-driven practices, build long-term sustainment through a train-the-trainer component, or determine who are best qualified officers to train and recruit. All of these can be objectives that are built into your program. Next slide. The objectives continue to also build positive community relations and trust, also enhance officer knowledge of mental health, behavioral health, reentry and wraparound services, disability resources, and diversion opportunities, and also to engage BJA's National Law Enforcement Mental Health Learning Site program as part of an ongoing training strategy. And last, as needed, provide information to actively collaborate with BJA and BJA's partners on program process and outcome evaluation efforts so that we can continue to inform the field. Next slide. I'd like to share with you a little bit about our law enforcement mental health learning sites. And this ties into one of the objectives on the last slide where we mentioned engaging BJA's national sites. This objective is better shown with a map to engage BJA's national law enforcement mental health learning sites as an ongoing training strategy. Each site is unique and offers different expertise. They're located around the country and they all have different expertise in different response models. And last, as needed, each one of these sites does provide information to actively collaborate with BJA and BJA's partners on program process and outcome evaluation efforts. So they have a lot to share. They're very eager to assist, and it takes no more than a simple phone call to arrange with our training and technical assistance providers to arrange a site visit or a virtual visit with one of these sites. Next slide. So on to program deliverables. Applicants must submit applications that propose both planning, process, and implementation phases for the training program for law enforcement or correctional officers. The planning phase is up to 12 months long to design the training program. And at the conclusion of the planning phase, grantees will submit their implementation plan to BJA's training and technical assistance provider. And next, I'd like to talk about the planning tool. So here is one of BJA's planning tools that was developed in collaboration with BJA's technical training and technical assistance partner. And this tool can assist agencies and program leads with program planning guidance. It can guide an agency from a partially implemented response model to a fully implemented response model. So it runs through the questions that will help you to assess where your agency is along the task and timeline. How far along is your agency to a fully implemented response? And sometimes just by going through the questions and looking at outcome measures, you can fully determine if you are closer to being fully implemented or not. It also provides resources that you can print out and take and share with your agency. There are many emerging models to think about, but regardless of what type of practice model or response model your agency decides to develop, improve, or enhance, each model should strive for the following outcome measures, which I just mentioned. These outcome measures will really help you to determine if you're truly making an impact with your response model. And these are increased connections to resources, reduced repeat encounters with law enforcement, minimized arrests, reduced use of force in encounters with people who have mental health needs. Next slide, please. So I'd like to just talk a minute about priority areas this year for the Department of Justice Bureau of Justice Assistance. And the overarching priority areas are really about civil rights and an increase in trust between law enforcement and the community, and providing access to the criminal justice system as well as access to victim services. So for the purposes of the priority consideration, the term in terms of high poverty area, which is also a priority area, this really refers to and means any census tract with a poverty rate of at least 20% as measured by the 2013 through 2017 census tract. It's a 5-year data series available from the American Community Survey of the Census Bureau. So we would just refer you to information that's provided by the Census Bureau for that. Next slide. Next, we'll talk about federal award information. BJA expects to make up to 46 awards of up to $150,000 each, with an estimated total amount awarded up to $6,900,000. All awards are for a 36-month performance period. The funding during the initial 12-month period must support planning activities followed by 24 months of implementation activities. Next, onto the budget. So this solicitation does not require a match. And if you're familiar with the Justice and Mental Health Collaboration Program, which has an increasing match, which can be very difficult to plan for, this program does not have a match. A lot of people are really happy about that. And while applicants will be required to submit a budget for the entire 36-month project period at the time of application submission, they may have the opportunity to revise their budgets based on any outcomes from the planning phase. So what we expect is that you will implement after the planning phase. The planning phase is a time for you to gather information, to do some analysis, to gather your stakeholders, and to put together a plan that you can then bring forth to BJA's training and technical assistance provider for feedback and to assist you with any questions you may have. And at that time, through this feedback, you might decide that you might want to change some of the budget, and you are perfectly allowed to do that. Next slide, please. So the budget continued. The budget should be complete, cost-effective, and allowable. All costs should be reasonable, allocable, and necessary for project activities. The budget should clearly indicate the cost for the planning phase, as I mentioned, just up to the first 12 months of the project. And the following costs are not allowed: prizes, rewards, entertainment, trinkets of any kind, monetary incentives, client stipends, gift cards, vehicle purchases, and food or beverages. The budget should include costs associated with travel for 2 persons to a BJA training and technical assistance related event. And right there on that slide, we do have a link to the OJP Federal Financial Guide, and we have a lot more resources at the end of this presentation. Next slide. So on to the review criteria. The basic minimum requirements needed to advance to the peer review process and receive consideration for funding are the proposal abstract, the proposal narrative, and the budget worksheet and budget narrative. These are the attachments that you must have in your grant application. Next slide. A little bit about performance measures and reporting. So as I mentioned, if you've applied for federal funding before, you may be familiar with federal awards and reporting requirements. We always have some type of reporting. Some programs require a little more and some require a little less. And although we won't go into great detail about reporting, it is required for this program. So that's the big takeaway here, is just to make sure that you're aware that you will have to submit performance measurement data in Just Grants, and we do have examples of that we can provide that can help. And here at the application point, it's just important that we make sure that you understand that there are reporting obligations. So further guidance on the post-award submission process will be provided if you are selected for an award. We typically gather everyone and conduct an orientation to help with resources and guidance and Q&A, of course, because there's always lots of questions in managing a federal award, of course. Next slide. So submission information. Applicants must include, as I mentioned, abstract, a proposal narrative, and a budget detail worksheet with budget narrative, and these are web-based forms. So here we would just ask you to see within the solicitation the application elements and formatting instructions carefully, that section of the OJP Grant Application Resource Guide for information on what happens to an application that does not contain all the specified elements or that is not responsive to the scope of the solicitation. It's really important to follow the instructions, and we're going to talk a little bit more about that later, just to make sure that you have all of the required parts of the application, because when you go through the basic minimum requirement screening, we do have partners that might screen you out of that peer review process. I do have a second look at those, and I'm very careful to go through, but it's really important to clearly label all of your attachments as what they are contained within that attachment so that they're easily identified. Next slide, please. So the abstract, the proposal abstract should be no more than 400 words, summarizes the proposed project, including primary activities, product deliverables, the service areas to be served in the project, who will benefit from the proposed program. It will be completed in the Just Grants form. So next slide is about the narrative. BJA requires the following when formatting the proposal narrative. So we ask that you do not exceed 10 pages, that you keep it double-spaced, that you use 12-point standard font. Times New Roman is preferred. It's fine. If you have another preference, that's okay, as long as it's really clear to read. Use 1-inch margins. Use sections in structured format that we ask for in the solicitation. And attachments do not count in your page limit. So a lot of people ask that. The narrative is just the narrative. And then just one note to closely follow. If you closely follow the formatting instructions, it will actually really help peer reviewers when they're reading your project. It makes it just easier on the eyes. You know, peer reviewers review a lot of grants and applications, and it's just very helpful to have it formatted just for the ease of reviewing and scoring your project. So you'll make it easier on reviewers, and they'll be very happy for it. Okay, next slide. So a little bit more about the narrative. I'd like to talk about the description of the issue. Here you want to describe and demonstrate the nature and scope of the problem to be addressed, successful efforts up until now, you know, where you've shown promise in your community, how federal funding will meet the need, how to sustain the program. And the project design and implementation is where we put the most weight on this part of the application. And this is where you're going to describe the strategy that you will use to meet your goals and objectives, include a timeline, describe shortcomings up until now, how federal funding will really sort of push it across the finish line, what you intend to do, what are the major tasks that you're going to undertake, what's the value add of this project, how is it going to impact and improve your community, improve the response, improve safety, and going back to your goals and objectives, how it's really going to do that. And capabilities and competencies is kind of the next biggest weighted area at 30%. And it describes the capacity of your partners, you know, your behavioral health partners, your disability partners. Who are they? What kind of expertise do they bring to the program? You know, describe how the program would be managed and how it would be structured. What type of staffing are you bringing to the program? The scheduling of the training and how you'll go about doing all that. And then who will be assigned to those tasks and why? Why is it important that they're assigned to those tasks to help make the program a success? And then last, plan for collecting, actually not last, I have two more. Plan for collecting and the data required for the solicitation's performance measures. So here you want to talk about how will the performance reports be collected and submitted? Who's going to be responsible for that? How will performance measures be evaluated? Will an outside entity be involved, which is fine, but you might want to talk about that. How will the program ensure independence and integrity of the evaluation? You want to talk a little bit about that. And we also, I think, require a statement with that as an attachment. So we'll talk about that in the checklist in a minute. But what is the process to collect the data? How will it be used to inform the program? And how will it improve the program over time? And last, the budget, which comes in at 10% when it's reviewed. And although the budget is a separate document, the narrative should describe the plan to expend it. You know, the who, what, when, where, why, how. How does it tie back to the goals and objectives? You know, your budget, even though it is a separate attachment, it should make sense as far as what you're trying to do. You know, the budget categories should make sense as far as your strategic plan. It should all sort of gel together. It should tie back to the goals and objectives. So, you know, just as a reasonable person would say, if you're going to have if you're going to deliver direct services, well, there might be somebody, a clinician or someone in that personnel budget line item or contract line item. So just so that it makes sense for your goals and objectives. Okay. So next slide, we're on to the required attachments. The budget worksheet and the budget narrative, as I mentioned. Also, the financial management questionnaire. The financial management questionnaire, it used to be due 120 days after you were awarded. I believe that's been extended to 150 days, but don't quote me on that. I think that just came like hot off the press this week, so I'd have to double check that. But there is I guess the takeaway there is a specified amount of time that you do have to complete some of your financial requirements. The questionnaire is really part of your application. There are other types of financial requirements that come later after you're awarded 120 days or 150 days. But this is part of your application packet. And it's really important that BJA understand that you have the capacity to manage federal funding. And then last, the disclosure of process related to executive compensation. And next slide, please. Additional attachments, if applicable, additional attachments include tribal authorizing resolution, research and evaluation independence and integrity statement, as I mentioned earlier. If you're planning to do an evaluation, as far as who is doing that evaluation and are they independent of your organization, is it, you know, we want to know that it's really done by someone that is really outside and separate from your organization so that they can give you a really good, clear picture of the change or the process or the progress that's been made as far as your program is concerned. Also, there is documentation of DOJ priority areas. We need a separate attachment if you plan on addressing the priority areas, and subrecipient information as well. If you're going to have subrecipients, we need to know who they are, the name of their organization, the city, where they're from, and there's a point of contact as well for that. Documentation of high poverty areas, that's another DOJ priority area, or persistent poverty counties. So that is also a separate attachment. So next slide, how and when to apply. So there are federal registrations that are really important. It's the very first things that you do when you're applying for a federal grant. And the federal registrations that you must have to apply are, of course, the DUNS and registration and grants.gov. And some of these things do take a few days. I would not wait till the last minute. I would definitely give it a few days just to allow yourself for any kinds of technical issues. And just one word on the DUNS number, even post-award, your DUNS number has to maintain currency. It has to continue to be current throughout the life of the award. And we go into all that post-award, if you are awarded, in that orientation when we talk about, managing a federal award. We do talk about some of these things just to make sure you don't hit any snags along the way. Next slide. Okay, so did I miss one? Could you go back for me, please, Daryl? I think. Okay, well, I may have missed the application checklist. I guess I'll let you go forward. Okay, here it is. The application checklist. I would really encourage you to use this checklist. It is a very helpful tool, and many have not made it past that BMR that I've mentioned. I feel like a kind of a broken record, but the basic minimum requirements is really just that. If those attachments are not there, your application will not go on to peer review. And I know many jurisdiction that's worked very hard to put together an application, and it breaks my heart when they don't get to go to peer review because they're missing one thing. So really use the application checklist, read the solicitation. If you have to read it twice, read it twice. But that's like some of my best advice there. Okay, so next slide. Hope this is okay. Submission resources. So they're self-help, full disclosure here. With Just Grants as a brand new system, we've all had to learn this system as well. And the videos are very, very helpful. The job aids are very helpful. I've had to watch them. My colleagues have had to watch them. I go back and I reference them myself. So I just urge you to take advantage of that, application mechanics and just watching a lot of these self-help videos through the Just Grants portal. Next slide. And important contact information. Everyone needs help from time to time, and this is a year for that. With so many new systems and so many new processes happening, here are the numbers for technical assistance, grants.gov. There's technical assistance for Just Grants, and also for the Response Center. And this is really where the questions need to go and where the problems need to go and get resolved. That's the only way we know what's happening out in the field sometimes. We collect up a lot of these questions and problems, and we analyze how they're resolved or if they were resolved, and we do that at the end of every grant cycle to improve our process. And it's really important that you get your questions answered through these sites. So, stay connected, definitely. We have so many resources on funding opportunities, learning opportunities, resources, guidance, Facebook, Twitter, and YouTube. So take advantage of that. Next slide. And then again, really important resources. I've kind of touched on these throughout the presentation. We've mentioned the Federal Financial Guide earlier. That for me, I have that on bookmark. I am constantly going back to it, and it changes every few years or so, but very important to go back and make sure that all your costs are allowable and allocable and reasonable. And, when you're thinking through your budget and you're going back and you're looking at your objectives, just to make sure, that everything is according to that financial guide, that you're not asking for things that are just not federally allowable. And then last, we are finally to the solicitation is available at this link here. And as I mentioned, read it very carefully. I suggest cover to cover and, tab it out, however, but the checklist is in the back, and I hope that it's helpful. And last, I think we're to Q&A. All right. Well, thank you so much for your attention during this webinar. It was a lot of information. I'm sure there's a lot of questions. And if not, the NCGRS is always available to answer questions. They get them right over to me. So even if I can't answer them today, we will get back to you. So I'm going to hand it back over to our host and Daryl and Tammy and let them see what's in the Q&A box.
Thanks, Maria. And just a note, I know there was a question on it, but just that the slides, the transcript, and the recording will all be posted to the BJA website within approximately 5 to 10 business days. So if you're looking to reference something that was talked about today, you can definitely do that. And that was just entered into the chat as far as the link is concerned. So once again, if you do have a question, the 3 dots bottom right side of your screen, click that and enter it in the Q&A, and we'll be glad to get to it today. So just starting out, can the planning phase be shorter than 12 months?
Yes, it can. It is up to 12 months, just to sort of put a cap on it, but a lot of agencies can wrap it up well before 12 months, and that's fine. You can, once you get feedback and approval from BJA's training and technical assistance provider, you can move on to implementation.
This one was asked in 2 separate questions. Are the funds excluded from being used for violent offenders like other BJ grants? And when they say violent offenders, not a murder per se, but more unstabilized, mentally ill person that acts aggressively, but when stable is not violent.
Right. So I think you're referring back to JMHCP, which is very different. Justice and Mental Health Collaboration Program really specifically talks about that in the legislation as far as preliminarily qualified offenders and who they are for a target population. This program's a little bit different, and you can respond, you know, mental illness is episodic, as you know, and, you know, people that may not have access to treatment could be in a really bad crisis situation, and there's a fine line there, and that's why we talk about safety and safety and safety. So yes, I mean, I can't say that it couldn't. I'm not sure the target population is much beyond people with severe mental illness or serious mental illness or disabilities that have not had access to treatment or services, and that's what brings them in contact with the criminal justice system, and their behavior may have devolved to such a place that they are in serious need of connections to treatment, and that can involve a whole host of behaviors that I mean I couldn't even predict. And I think, you know, it's just discretion of the responding team is really important, and having resources is really important. So, so it's not quite as prescriptive in that way as far as responding to people who could potentially be aggressive or display aggressive behaviors. I think that's oftentimes just what happens in the field because of a need for treatment.
Is this solicitation for correctional settings to partner with community BHID offices rather than BHID offices looking to partner with correctional settings?
So I would refer you back to the eligibility. It really is the eligible entity to apply is the correctional entity, and it is the solicitation is targeted towards state, tribal, you know, government, local government, and correctional facilities. And the intention there is to definitely partner with those that have clinical expertise and behavioral expertise and disability expertise, and to bring that expertise and that skill set into correctional facilities or upon reentry in terms of having a smooth transition for that person back into the community and have connections to treatment and services that are meaningful that help that person as they reenter. I hope that answers the question.
Can this grant be used to expand and utilized in an already existing co-responder program?
Yes, absolutely.
Can part of the award be used for civilian staff salaries or for officer overtime needed for training?
Yes, if they are supporting the program. I wouldn't say, just any person in the agency that's non-sworn. If you're referring to civilian as like non-sworn or lay people, there's lots of supporting positions in any agency, of course, that could potentially support the program. It could be an analyst or someone that is supporting the program, someone who is a coordinator for the training. And oftentimes people, if they go to training, they have to have funds to maybe backfill a position for someone that needs to go to training. So yes.
Related, can this be used for CIT training?
Yes, so crisis intervention team training, BJA in collaboration with the University of Cincinnati we are adding content and dusting off the National Crisis Intervention Team curriculum. It's a Memphis model style 40-hour curriculum, and it is going to pilot this fall. It should be ready and available next summer, so I'm sort of making a plug here, but this will be an academic-based 40-hour training curriculum that's free. It's paid for by BJA, and it'll be available with instructor training, instructor notes, participant notes, slide deck, evaluation, the whole 9 yards.
This particular person's a state police agency, and they train in one central location for the state. It seems like most of the training should be geared towards local communities and not the state as a whole. Is this something that should be pursued, or is it not suited for this particular agency?
So BJA wouldn't, we would help you to roll it out in your, jurisdiction as best as we could through training and technical assistance. And in some states, yes, it is local response, but in some states, the way it's set up, local agencies can take advantage of training in a regional sense. Some states set up regional training so that local communities can take advantage, especially in rural communities and rural parts of different states. So how it's structured and how it's set up, it's really up to states and tribes and local communities to think through that. But we wouldn't be opposed to that if the training gets to the people who need it. So it just depends on how it's set up there.
Is part of the funding allowed to bring a social worker into the police department to assist the community and the officer with people in mental health crisis from both a proactive and reactive standpoint?
Yes, that would be allowable. It could be considered a co-responder model. We have some information on our academic-based training website, which is through the University of Cincinnati. It's hosted by the International Association of Chiefs of Police, but it does run through all the various best practice models for response. And there's a whole host of information. There's just a wealth of information on that website. And I'm really bad at throwing things up in the chat, and I've got all kinds of windows up right now, but I will get that out to everyone through our host.
Does the application require cross-jurisdictional partnerships established for the purpose of applying, or is the application meant to be solely spent on a program serving one law enforcement agency and the community it serves?
It's really intended to support the applicant entity or the law enforcement agency or the correctional entity to provide this training, to design a model response, to deploy the training. But when you implement the training as part of the program, the training itself is one piece of it, right? And then you have to really have community partnership, and the other half of it is services, because we could train really, really well, and officers and people that are responding could have all the best information that we could give them, but without real partnerships with service providers and all those contacts in the community, it would be very difficult to serve the population that we're serving without all those partnerships and services really that have to be in the community and on the other side. So the idea is that you bring those services and those community service delivery partners, and you cross-train with those partners as part of your curriculum, and you deliver it. And in doing so, the officers know who the service providers are. You build relationships, you train together, you work together, and when those encounters happen in the community, people are connected to those providers. So it is intended for law enforcement agencies to be the lead, or correctional entities to be the lead, the government entities, state, tribal, to be the lead. But to be successful, partnership is really innate to the program.
Oh, I'm sorry. Related to eligibility again, there are limitations to can apply. For example, a private entity that works with the courts and state agencies, for example, the Department of Children and Families, and referrals, as well as FDLE certified officers as employees to ensure safety at the site. However, we're not a correctional site, although they do work with forensic psychiatrists in jails and settings.
So I truly appreciate and understand that all those partnerships are so important. The eligibility really falls back on the government entity, as is outlined in the solicitation, states, tribes, local governments, and correctional entities. But given that those partnerships are necessary, there can be subrecipients to the program. So the applicant entity can, totally partner and write in those partnerships into the funding and as subrecipients of that program. And they would manage that subrecipient just as if we, manage with the applicant entity. If they're receiving federal funds, they would apply, all the same rules would apply to that subrecipient, but they would truly be partners in the project. And I hope that helps.
Regarding allowable costs, is it okay to give gift cards or other incentives to express support and appreciation to trainees?
No, and that you'd have to go back to the federal financial guide, and we can maybe scroll back to, we had it on the slide. I think it was on one of the budget slides, but unfortunately, no. And there's lots of reason behind that. I know that incentives can be a really important part, but I would, if you want to have that as part of your program, just a little bit about that. Before I was at BJA, I came from the state. I came from county level work and nonprofit work, and I would just encourage you to find other ways to provide those incentives. I think they're important, but I would not use. You cannot use federal money to do that. I would find other ways to do that, and it creates buy-in, and it makes the community feel like they're being a part of this program and of this change.
Thanks, Maria. And yeah, for reference, the slide's up now, third bullet here. I'll go through that list of allowable costs. Mm-hmm.
Great, thank you.
Can the mental health expertise be utilized by a police department employee and not from an outside mental health agency? Can this mental health position be paid for by the grant?
Yes, that sounds great. I could think of, I know several law enforcement officers who are also forensic nurses, believe it or not, and they are very skilled and very expert in running programs involving people with mental illness and responding to people with mental illness. And I wish we had more of that. in talking with our now 14 law enforcement mental health learning sites, I have heard from several learning sites, they have urged a new area of field, of a career field for field psychology and more forensic psychology, more training clinicians who also understand the criminal justice system and are there to liaise between both and can really understand both, because they're very complex systems and sometimes competing interests, but at the same time still responding to the same target population. So if you do find, that you have that expertise, I think that's great.
Can EMS providers be trained as part of this initiative? Our co-responder model includes law enforcement, paramedics, and behavioral health social workers.
Yes, I think that's great too.
Could any of the funds be utilized to pay for behavioral health providers' wages and wages for the utilization of certified peer specialists?
Yes, as subrecipients, they could be in the contract line item, they could be in the subrecipient line item. They would need to tie back to your goals and objectives of the program and be talked about in the narrative and in the capabilities and competencies in terms of what expertise and value add they would bring to the project.
And then to confirm this, the correctional facility entity should be the main applicant, correct?
Yes, thank you.
And there's two questions on the same topic here. Regarding the police mental health collaboration assessment tool. It seems that the online tool requires identification of a law enforcement agency. This particular person is not with a law enforcement agency, but works in behavioral health policy. Is this accessible by others than a law enforcement agency?
Yes, it should be. We host it along with the Council of State Governments Justice Center, and it's also provided on the Police Mental Health Collaboration Toolkit, which is hosted by BJA. So BJA hosts the PMHC Toolkit, and on the main page, there's a link to the assessment tool. And the assessment tool will jump you over to the Council of State Governments Justice Center. And they do require an account. I know you have to set up an account or something like that. And it's just, the only reason it's very brief, it's like, I think just 5 questions or so. It's not a lot, but just so that they know who's accessing and to be able to provide training and technical assistance and more resources, so they know what to upload as far as resources. So you can access that if you reach out. If you have any trouble, please reach out to me or to the Council of State Governments Justice Center and request assistance.
And the second question from this individual is there a contact list for the law enforcement mental health learning sites that includes names, emails, and phone numbers?
Yes, there is, and it is on the Council of State Governments Justice website. It has just been updated, and they have a really nifty map of the United States. It's kind of like, it's very geometric. It kind of has shapes on it, so don't be thrown off. It doesn't look like an exact map that I had here on the slide, but it's sort of a artsy sort of looking one. But when you hover over the state, it will give you the information of what they provide, where they are, who the contact information is. But we like to give them a little bit of a heads up, and we like to, of course, you can always reach out to them. I mean, we would always say, ask the question if you need to ask the question, but we do try to schedule, if you do want to do a virtual site visit or something like that, we try to schedule it with them just to help manage it, and that's through the Council of State Governments Justice Center. And you can go through the Training and Technical Assistance Center to schedule it if you'd like.
Can the grant application be spearheaded by a county government behavioral health agency who would like to partner with correction settings throughout the county served?
Yes, that sounds fantastic. Yes.
What's the cost of the training, the trainer training? Does that need to be included in the budget portion of the proposal?
Train the trainer component. So if that's what your project is intended to be, you would definitely want to budget for that. I think, do you want to read that question again, Daryl? I'm not sure if I...
Yeah, it's what is the cost of the training and train the trainer training? Does that need to be
the cost,
included in the budget portion?
okay. So all of BJA's materials are free. So first of all, I just want to say that, you know, everything that we develop, you have access to, and it is of no cost to you. Where the cost comes in, as far as, especially with like 40-hour curriculum, the cost comes in and getting a site, arranging for, you know, maybe if you have to have lunch brought in or something like that, or some other types of costs associated with actually putting on, you know, a 40-hour training, if that's what you're planning to do, is to use BJA's national curriculum and put that on, train the trainer. If you want to incorporate that into your program in terms of salaries, you can do that as well. You know, costs for personnel, salaries, those are all allowable costs.
And going back to the previous question, Maria, this individual had asked for you to repeat the question where you said, yes, this sounds fantastic. It was, can the grant application be spearheaded by a county government behavioral health agency who would like to partner with correction settings to route the county served?
Okay, so I missed the part about it being, I heard a county government. So if it's a county government behavioral health entity, it would have to be county government. So that's where the eligibility might get, you know, a little bit sticky, but it would have to be the county, the county. So not a nonprofit. But it could be spearheaded as long as it's a county government entity.
Thanks for that clarification here. This particular person, cities manages the allocation of all funds awarded to the police department. The lead point of contact in the department grant applications is always the city treasurer. And when they select the drop-down box, he states the applicant is the city. Although the programs are designed for the HCPD employees. Does this need to be done differently in this particular application?
So we've seen this before. It's not a problem. Oftentimes, even with county sheriff's offices, sometimes the county applies, because they're the holder of the federal registrations. But the implementing agency is the sheriff's department, and that happens all the time. That's fine. You know, if the county is the applicant and the city or the local entity is the implementing agency, you know, that's fine. But you know, whoever the authorizing official, you know, whoever those folks are that are required to submit an application in Just Grants. So those are going to be the folks that will be responsible for, you know, the reporting and the anything else as far as managing the award. They would be the ones that would be responsible. So if there's a big separation between the implementing agency and the county agency, I would just recommend that, you know, that there's just good communication in terms of deadlines and things like that. And we get into that more in terms of the orientation after awards are made.
This particular person wanted to review the award information again, just to kind of go over this slide, if you don't mind, briefly.
Certainly.
It basically is $150,000 for the first year planning, and then what from there is the question.
So the $150,000 is the total award. So we didn't specify any dollar amount in the first 12 months for planning. Like you'll notice with some of our other programs, we might say up to 100,000 or something like that. But because this is a smaller award, we didn't specify that. But that's the total award is 150.
That seems to be the end of the questions in the current queue, Maria. Anybody else have a question? Please start to enter it in the Q&A box. We have about a minute left till the 2 p.m. And then just following up on that total amount, it can be used for salaries, correct?
Yes, that's correct.
And then just to reiterate, the slides, PowerPoint recording from today will be posted at the BAJA website in about 5 to 10 business days. That was entered in the chat. So please, if you need to go back for reference anything, you'll be able to do that there. And also, once again, the three entities here, if you have any questions, grants.gov, Just Grants, or their GP Response Center for anything technical assistance related with the solicitation. Here's your information here. So with that, Maria, I think that's the end of the questions. Is there anything in closing you wanted to mention?
All right. Well, thank you very much for all your time today to participate in the webinar, and I wish you all the best of luck, and I hope I get lots of applications from everyone on the call today. Take care. Bye-bye.
Okay, so on behalf of the Bureau of Justice Assistance and our panelists, we want to thank you for joining today's webinar. This will end today's presentation.